Welcome to the Therapy Thoughts podcast. I'm Cooper Mann.
And I'm Jordan Mead.
We're students at Apex Friendship High School, and we want to change the mental health game. Today we'll be discussing on how mental health is handled in facilities and how it needs to be changed for the better.
Later in this episode, we'll interview an expert on the subject to gain insight into how mental health care can be reformed for the better.
There have been several times throughout history when there has been a bias amongst people with mental health disorders. This dates back to even the book One Flew Over the Cuckoo's Nest, which was released in 1975. Throughout the book, it exemplifies how corrupted mental health facilities were then and even relates to the current decade.
Historically, mental health care facilities have often not treated their patients with respect. Mental health care professionals have often been corrupt and abusive in the past to the patients and given them medications and treatments that may not have actually treated them and in some cases may have been harmful. A historic example of this is in President John F. Kennedy's eldest daughter, Rosemary Kennedy. Rosemary was dealing with a number of mental health issues, and so her parents made her get a lobotomy in which they cut out a part of her brain. At the time, a lobotomy was not a viable mental health treatment, and ultimately it paralyzed her for life.
There have been several studies that exemplify how mental health facilities have not changed at all over time. One study done by Professors Piotrowski and Keller in 1989 suggests that despite the availability of new assessment instruments, doctors continue to rely on traditional tests. Another study done in 1979 suggests that the opposition of these facilities is limited to local minority and does not represent the views of the entire community. The study argues that public response is influenced by the characteristics of the neighborhood hosting the facility itself, and the public's attitudes towards the mentally ill.
According to Healthcare, a Right or a Privilege by Corinne J. Naden, approximately 26.2% of Americans age 18 and older suffer from some form of mental illness. Many people may argue that healthcare is more accessible than ever because of federal health insurance such as Medicare. However, this mental health care often comes too late, is too lengthy, or is too expensive for the average American to fully get all of what they need.
We'd now like to introduce Francis Hughes, Apex Friendship High School's own Student Assistance Programs counselor.
Unfortunately, it is insanely hard. It is insanely hard to find a good or residential treatment for adolescents.
Yeah, because the only one that's around here is Holly Hill.
This is long term. So short term, I will go on record to say rarely now will I refer a kid to Holly Hill or any type of hospitalization. Those are basically for stabilization. A student that is in just a high level of crisis. We're going to a different model, which I prefer. It's a day treatment model. So the kids can live at home, but go to a facility in the day, go to a hospital in the day and get treatment versus living there. It's horribly scary.
Yeah.
For a child to go to a hospital.
Yeah, my brother went to one, so I understand.
It's got all levels. You have very aggressive kids there to kids that are just super anxious and depressed. It's entirely different kids, but they're all in the same pot.
In the one, yeah.
And it can be, I hate to overuse the word traumatizing, but it can be traumatizing. So I'm more inclined to get a short-term assessment and then get more treatment in the day where they can live at home, where they feel safe and secure, but get the really intense psychological treatment that they need.
What is your take on how mental health is managed in schools? How do you think that, do you have any opinions on how it could be better? How it could be, more prioritized?
I will give you one sentence. I am one person. How many students are in this building?
3,000.
Why don't you answer that question?
Extremely hard.
And then I've asked for it, and people look at me like I have 10 heads.
Yeah, exactly.
Think you answer the question. There's one of me. That's it.
It's actually a pretty good answer for that question.
Yeah. Being one person is kind of really hard to deal with a bunch of students, especially because I know a lot of the people in our school don't really get the treatment that they need outside of it.
Right, and to be really honest, and I feel horrible about it, they don't get the time that they need, and they probably don't get the time they need from me.
Are you the only person here that deals with this kind of thing? Oh, that makes it pretty difficult, I imagine.
They do. The grade level does. But remember, they're in a high school level, they're, especially in this building, what's their major focus?
Keeping their grades up.
Yeah, and getting you to where you need to be after high school. I respect that. We have a part-time nurse and one social worker to 2,800 kids. There are days that all I do is crisis. So I don't, like, these guys keep schedules. I don't keep a schedule. I don't.
What time do you typically, like, see that around and during the school year? Like, is it, like, during, like, finals week, or, like, does it, like...
That's a great question. The winter's hard. January and February is hard.
That seasonal depression,
It
hits.
Yeah, it is true. The January and February, once kids get settled into school, I'd say the end of September, October, start having some social issues. Right now it's really quiet, which is good.
Yeah, it's good. Well, it's about to be summer, so it's like...
Right, everybody's kind of gearing up. It's like, oh, peace out.
Yeah.
The winter's pretty hard. But I have like a caseload of, say, 15 kids. So I just kind of rotate to see check on them. How are you guys doing?
Yeah.
Like a kiddo I saw yesterday, I was just doing a check-in. She's going to college next year, just making sure she's in a pretty good spot. I'd worked with her quite a bit in the school year. So it's kind of, I have a light caseload because the primary job is crisis.
I guess, I don't know for sure if this is like your area of expertise per se, but not specifically like at a school, but like in general, do you have any like, I guess like thoughts on how healthcare facilities can be like reformed to be better for the patients, or no?
For adolescents, right? Yeah, we're really just talking about adolescents.
Basically.
Yeah. Gosh. I think about that because that's the magic wand question. Like, God, how can you really do a good job taking care of kids? We need more facilities. We need more therapeutic, long term, and getting creative.
Yeah.
Like the one I really love. I try to I do probably 1 or 2 applications to it a year. They have equestrian therapy, they have art therapy, they get creative versus just putting a kid in this box.
Like a blank wall, right box. Just like, that's when people go crazy.
Yep. So getting more creative, more tax dollars to mental health rehabilitation versus criminal rehabilitation for drugs. There needs to be a shift. The money that goes to, juvenile facilities and adult facilities for drugs, it needs to go to rehab for mental health because, the two, as we know,
they like intertwine.
But as far as this population, there needs to be some serious mental health rehab and to lift the rug up, that kids really need some support and help. Typically kids that are pretty high level drug users, there's, some... We know that, research-based, some mental health behind that. So, some more insight on that to helping kids address that. But that's, I guess, just more creative opportunities for kids rather than just putting them in Holly Hill. And off on drugs, off you go.
Yep.
Because that's pretty much what we do.
I also know, like, the surveillance around Holly Hill is not, like, the best. Like them keeping control, because it's kind of hard too when there's like you said, if you're one person per like 15 kids, it's kind of hard to like keep control of like what they're doing and stuff.
And how do you keep, the other thing with Holly Hills, how do you keep, it's a beautiful facility, but how do you keep the employees? I mean, the turnover is insane. It's totally insane. So they're hard jobs. Dealing with adolescents in crisis is not fun, but they deserve to have highly qualified people, and you just can't keep them. You can't find them, and you can't keep them.
This issue is depicted in the novel One Flew Over the Cuckoo's Nest by Ken Kesey. The staff of the mental facility in the novel is clearly corrupt and not fit to serve the needs of the mentally challenged patients that live on the ward. Nurse Ratchet abuses her power in the novel, forcing patients unnecessarily far outside of their comfort zone and making them take sketchy medications that do more harm than good. One patient refused to take his medication because it literally made his gums rot, and the staff punished him for that. There are many other instances of mistreatment of mental health care patients in this novel as well. One of the worst ones in the novel is when McMurphy, who is of reasonably normal mental health, tried to protect his helpless friend by fighting back, and so the staff forced him to get a lobotomy, which would have left him essentially dumb and immobile for life.
Thank you for joining us on our podcast.
We hope you learned something new today and hope you feel inspired to go make a difference in your community for the betterment of people's mental health.